Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. In the previous lectures, and we have discussed about the anterior compartment of the thigh, and there we have discussed about the muscles of the anterior compartment of the thigh and the contents which are present in the anterior compartment of the thigh, that's the artery, vein and nerve. And these all things, they are actually present in an area which is named as femoral triangle. And during our discussion we have seen that the two things, that is the femoral artery and vein, they are covered by a sheath, not the femoral nerve. Femoral nerve is outside the sheath. The artery and vein, they are within the sheath, and that sheath is named as femoral sheath. So today we will discuss, we will see what is actually is the femoral triangle, how it is formed, and what are the contents, what's its clinical importance, and what's the sheath, femoral sheath is, and how this is formed. Along with that, we will discuss about the location and boundaries of the adductor canal. So, first we will see, let's create a scenario that a 45 years old female presented in the OPD with a swelling in the upper medial side of the thigh. So in which area this swelling is present? So this swelling is present obviously in the femoral triangle. So we will see how is the. So I will request you people that you should have the authenticated book open with you, and also the atlas. It's very important to open the atlas, place it on the side of you so that the things can be confirmed while seeing the atlas, and you should yourself be able, and also concentrate on your own body, that where this, at which area this these things will be present on your own limb, as I have told you previously in the previous lectures. So here if we see, here is the area of femoral triangle. If we place our thumb over the iliac bone, we can feel the anterior superior iliac spine. So here is the anterior superior iliac spine. Here is. And if we go medially, here is should be the pubic tubercle. So this line is actually presenting the inguinal ligament. Inguinal ligament. There is another line. If we recall ourselves that one muscle of the interior compartment of the thigh was sartorius rope-like muscle, which was originating from the anterior superior iliac spine, going obliquely downward to the medial side of the tibia. So that muscle was the sartorius, and actually this line is of the sartorius. And if we imagine this line which is running obliquely from the pubic tubercle and joining the line formed by the sartorius, and this part of the thigh is actually the medial side of the thigh, and in this medial side are present the adductors. Adductors of the thigh, adductors of the femur, adductors of the hip joint. So these muscles, when we will study, there are three muscles, the longus, brevis and magnus. Their names, as their name implies, a longus will be long enough with a long tendon, and the brevis will be having short body, the thick body and short tendon. Magnus, it's a big. So this line actually should be presenting a muscle that is the adductor longus one. So we can locate the triangle on our own body seeing this. This area is of femoral triangle. Now if we go to the next slide, we have removed the skin over the from the front of the thigh, and same lines are there. So we see what here is a line from anterior sphenoid spine to the pubic tubercle, and that's the line of inguinal ligament. Here in this line we see this the pectineus, and if we see this, here is a line coming down, and here is the muscle is the adductor longus. Pectineus is lateral to it, and most laterally will be the iliopsoas muscle, and a line from anterior sphenoid spine coming down, and this muscle is the sartorius muscle. So this will show us the boundaries of the femoral triangle. These are very, very easily understandable. The boundaries of the femoral triangle. Now again, I'm putting these two diagrams side by side, and we can confirm this. So here is very easily confirmed about the femoral triangle. So in the scenario, what we have said that if a swelling is present here in this area, that may be an inguinal lymph node, that may be part of subcarcinoma. So if it is located in this area, so where this swelling will be present? In the femoral triangle, medial part of the femoral triangle. Say if you have here is the femoral artery, and if there is aneurysm of this, so, and again, where will you try to feel the femoral artery? In the femoral triangle area. Okay, so here are the boundaries of this shown. So boundaries: spirally inguinal ligament, laterally sartorius, and medially adductor longus muscle. The floor we have seen iliopsoas, pectineus, and adductor longus, and the roof will be skin, subcutaneous tissue, fascia of the thigh. Again, I go back to the previous slide. So if I go previous to it, we are seeing here is the iliopsoas laterally placed, then is the pectineus, then is the adductor longus muscle. So floor is formed by the pectineus, lateral to it is the iliopsoas, medial to it is the adductor longus. This is the floor, formation of the floor. And obviously if I go back again or forward again, here is the skin, superficial fascia, and superficial inguinal, superficial things, they will be forming the floor of the roof of the femoral triangle. Floor is here, iliopsoas, pectineus, adductor longus, the floor. So we have understood the boundaries: spirally, medially, laterally is the boundaries of femoral triangle. We have understood about the floor, laterally, medial to it, and most medial to it, and the roof, skin, superficial fascia. Now here are shown the content. As you have previously seen this. This is showing the content of femoral triangle. So you can label the contents from lateral to medial or from medial to lateral. So most medially will be the femoral canal, then lateral to it is the femoral vein, then is the femoral artery, then is the femoral nerve. Here you can see these two things, femoral veins and artery, and this canal which is having the lymph nodes. These are covered by a fascia which is called as femoral sheath. And this nerve, femoral nerve, is not included within this sheath. It is outside the sheath over the iliopsoas muscle. Because it is from the abdomen, it is coming behind the iliopsoas fascia. Now contents, we have seen it: femoral nerve, artery, vein, and femoral sheath, and inguinal lymph nodes, deep inguinal lymph nodes. Superficial inguinal lymph node, we have already seen the superficial inguinal lymph nodes which are located superficial to the deep fascia, but the deep inguinal lymph node will be deep in the femoral triangle. So here we are seeing the content of the femoral triangle. In this cross section has been shown the things coming from the above also. In this diagram, you are seeing that in the most medial part is the femoral canal, then lateral to it is the femoral vein, then lateral to it is the femoral artery, and here is the boundary which is enclosing it, that's the femoral sheath. Okay, femoral, here the lymph node, and deep inguinal lymph node will be present here. And if you are looking at this femoral sheath, the septas are moving inside and covering the individual vessel also, separating them from each other. And if you go laterally, here you see that this nerve is lying over the iliopsoas muscle. Behind the fascia it will come down, so it is not included within the femoral sheath, it is outside the femoral sheath. So here is the iliopsoas tendon of iliopsoas muscle, and this will be going down. So, and here you see in the content, here is the saphenous opening. Then here you can recall yourself that this opening where the great saphenous vein is opening into the femoral vein, where will you find it? You will find it 4 cm lateral to the pubic tubercle and below the inguinal ligament. 4 cm below the inguinal ligament, and it will be covered by the cribriform fascia, connective tissue. And here is shown the falciform margins, means these are the margins of the femoral sheath. Here is the saphenous opening. So we have seen its contents and how they are formed, and now we go to the next slide. And what is a sheath? Femoral sheath. It's a sheath is a prolongation downward into the thigh of the fascial lining of the abdomen. Say abdomen. Abdomen is covered anteriorly and posteriorly by the fascia. So anteriorly, this fascia is covered by fascia transversalis. Posteriorly, there is iliopsoas fascia. So when the vessel comes down into the thigh from the abdomen and greater pelvis, the femoral sheath, then it covers this. So it is having 3 compartments: lateral femoral artery, intermediate femoral vein, and medial femoral canal. Here, this formation is more, here is again showing the covering of the femoral sheath. So this fascia lining is anteriorly, and here is posteriorly the iliopsoas fascia. So if this is anteriorly, and now we can recall or we can search that this fascia is of fascia transversalis. That's the more innermost muscle of the anterior abdominal wall, transversus abdominis, that is covered by a fascia transversalis. So anterior will be the fascia transversalis, posteriorly will be the fascia iliopsoas fascia. And here you are seeing, here is cut margins in which the iliopsoas fascia has been cut, and here you see the nerve is passing beneath, deep to the fascia. So if it is deep to the fascia, it cannot come to lie in the femoral sheath. It is already outside the sheath. It cannot come. If it would have been over the fascia, then there are chances that it can become the content of femoral sheath. So if we see the next slide, we see here the fascial lining. This slide is very useful, and if we see, in my opinion, you should draw it yourself. Try to draw it in simpler ways. This will be helpful for you in the examination point of view. So here we are seeing this is the femoral sheath, and here is the covering from the anterior side, and anterior side is the fascia transversalis. Here is the iliacus muscle, iliopsoas. So posteriorly is the fascia which is covering the iliopsoas, And most, if you come medially, a little bit medially, it's the pectineal muscle which is also covered by the fascia. So posteriorly formed by the iliopsoas fascia, and here you can see it is behind the this is the iliopsoas fascia, and it is beneath the fascia, and here is the anterior layer by the fascia transversalis. Okay, so this is the femoral sheath, and here the femoral branch of is given, and it is the vein, and this is most medial is the canal, then is the vein, then is the artery, then is the nerve. So this diagram you should try it yourself, and you should draw it yourself. Here one thing is also very well understandable here, that here is the inguinal ligament attachment from the anterior superior iliac spine to the pubic tubercle. From here, the backward extension of the inguinal ligament is the lacunar ligament. So when we see it, it's a lacunar-like margin, half moon-like margins, lacunar ligament. And if we little bit concentrate here, recall that if this is the medial side, so this will form the medial boundary of the femoral canal. Yes, this will form the medial boundary of the femoral canal, and laterally will be the septum separating the femoral canal from the femoral vein. Anteriorly will be the inguinal ligament, and posteriorly will be the pectineus muscle covered by the fascia. So we can very well understand the boundaries of femoral canal also, because this is very important. We will see it. Medially will be the lacunar margin of the lacunar ligament. It's a sharp one and a small one. Laterally will be the septum separating the femoral canal from the femoral vein. Anteriorly should be the inguinal ligament. Here we can see inguinal ligament. And posteriorly will be the fascia covering the pectineus muscle. So here we can revise also the boundaries of the femoral canal as well. So what's the importance? That's you are seeing in this diagram, what the doctor is doing is trying to feel the femoral pulse. In this man, maybe the peripheral pulses of the lower limb, right side, may not be palpable, and there may be cyanosis of the foot. But to confirm whether his blood is coming from above is not, we have to feel the femoral artery. So here we will feel the femoral artery. So how it beneath the inguinal ligament, we will feel it 1/3 distance from the pubic tubercle and anterior superior iliac spine. Standing on the ipsilateral side, patient fingertips on the examining hand pressed firmly into the groin. Auscultation can also be done. So you can practice this on your body also. If you are sitting there, try to feel your femoral artery, your own femoral artery with your own hand. I think so that you will be able to palpate it. You will feel the femoral pulsation of femoral artery in the femoral triangle of your own body. You can do it, and you can see it on the diagram also on the atlas. Here what the person is doing actually. So with the left hand, doctor is feeling the pulse of the femoral artery, but with the right hand he is passing a cannula and trying to pass it into the femoral artery, not the vein, femoral artery. Why? So that during the he can put a catheter into it, and he will be able to do angiography to visualize the blood vessels on the X-ray by putting a dye. So you can put catheter from here, which can go up, and even into the coronary arteries for the coronary angiography or you can put a catheter simpler here and put a dye to look at the vasculation of the lower limb. So catheter can be put into the femoral artery, and this is actually a common pathway used by most of the doctors in the cardiology to do coronary angiography, that the femoral vein catheterization. Other veins, other arteries, femoral artery catheterization. Other arteries which can be used are the radial artery in the hand, that can be used for the catheterization. Other artery is a subclavian artery in the neck, which can be catheterized for the angiography purposes. So these three sites, the most commonly used is the femoral artery in the lower limb. First to palpate it, and then you can catheterize the femoral artery. And where it is present in the femoral triangle. Most medial part of the femoral sheath is the femoral canal, and we have seen in the previous slide the boundaries of the femoral canal. What's present actually in the femoral canal are the lymphatics. What actually is the femoral canal? Actually, the femoral canal is the communication between the anterior abdominal wall, anterior of the abdomen, and the medial side of the thigh. It's a communication. It's a shorter one. It's not the bigger one, shorter one, but this is a communication. There is a space. There is a tendency for the intra-abdominal organs to come through this canal and comes out on the medial side of the thigh, upper part of the medial side of the thigh, below the inguinal ligament. So this, if the organs, that is small intestine in the abdomen, is coming through this canal into the thigh, so it means a herniation of the contents of abdomen into the thigh. So this herniation is coming through the femoral canal. That's why it will be called as femoral hernia. Because of is more common in the woman. Why? Because wider pelvis is there, and so femoral canal will be wider. Hernial sacs pass down the femoral canal, pushing the femoral septum before it, escaping through the lower end of femoral canal, expanding to form the swelling in the upper part of the thigh, deep to deep fascia. Further expansion, hernial sac may turns upward to cross the anterior surface of the inguinal ligament. So what our first scenario, in which we have asked about that a swelling is present in the upper medial side of the thigh. So what does this mean? That means that swelling can be due to enlargement of the lymph node. That can be a femoral hernia. But the important point here is that we are seeing here the femoral hernia. There is another very important form of hernia, that is the inguinal hernia, that is actually coming through the inguinal canal. So we have to actually differentiate this inguinal hernia from the femoral hernia. So this was all about the femoral hernia, femoral canal, femoral triangle, femoral sheath, femoral canal, and femoral hernia. So hope for the best. Inshallah, we will discuss by a short lecture about the adductor canal. Now onward. Thank you. God bless you.